What happens to jowl fat during a face neck lift? Is it repositioned or removed, or a combination of both? I am considering having a face neck lift, and the above photo clearly demonstrates the descending jowls obscuring my jawline. I am 51 and have reasonable skin condition. The jowls are not just skin, but are full and fatty. What happens to this fat during a facelift? If it is repositioned, where is it repositioned to, or is it removed altogether, or is this something that is customized for each patient? What are the benefits and disbenefits of the differing techniques to deal with this issue? Thanks.
Thank you for your question. You submitted a photo and you described that you're 51 and you're demonstrating the concern you have about jowls, and you're asking what happens to the jowl fat during a face and neck lift. And you're asking about the method, whether it's repositioned or what is done, or is it customized. Well, I think I can give you some perspective from what I do in my practice. I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and a fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. Facelifting, face and neck lifting is a very significant part of my practice, and I can share with you what my approach is and a little bit of how it's evolved over the years. To answer your question, essentially the answer is it has to be customized. No two people can have exactly the same procedure. And when you do your research and meet with doctors, you will get varied opinions on what is the best way to do what you want. And so you'll have to kind of filter them and see which one you're most comfortable with. But to understand the jowls, it's very important to also understand anatomy. And it's part of the reason why there's a lot of people who have had suboptimal results, whether it's with a facelifting surgery, whether it's with an injectable, or whether it's with a thermal heating device that claims to be able to lift the face. So let's understand the anatomy a little bit. You see, the term jowl can mean basically one thing. It's the absence of clear definition of a jawline. What contributes to the jowl appearance can be several things. We'll start with the level of at skin deep, at the skin, right below the skin. Right below the skin, where the skin hangs over, there can be a small amount of fat. Now, that fat can be defined as fat that has shifted downwards. So the question about repositioning is certainly a valid question. Some people would feel that the fat represents fat that has not only moved downward, but is kind of separate. And we sometimes see this in facelifting surgery. And in situations like that, the fat can be excised. Now, how it's excised, some people will do liposculpture first and then do the lift, or will do direct excision. The other factor that's often underappreciated is part of that jowly appearance has to do with something called the buccal fat. Buccal fat is fat that's in a very distinct compartment, which creates a certain amount of fullness. There's actually two types of situations with buccal fat. One is where there is kind of like a diffuse but localized fullness, and then there's something called buccal fat herniation, where the fat protrudes out and almost creates this roundish little bulge. The point is that you don't have a one standard approach and system that is going to work the same for everybody. In my practice, when I'm doing surgery, this is often a dynamic process. Yes, I make certain observations and determinations before surgery, but during surgery, as I'm doing the work, as I'm lifting, as I'm moving the muscle, the layer called the SMAS, or superficial muscular aponeurotic system, I'm looking at the contours and I'm making decisions. I'm looking to see if buccal fat is prolapsing outward. Sometimes I'll take out buccal fat from inside the mouth before I actually do the lift. When I mentioned about the evolution of this procedure in my practice, I can tell you that there was a time where it was almost a given that any patient who had a little bit of jowl fat and a little bit of fat under the chin would get liposuction first before the beginning of the surgery. In my practice, for me, it's evolved. I'm actually more conservative about the application of liposuction before doing the facelifting, and more doing something like liposculpturing with direct excision, where I'm not traumatizing the tissue as much. Now that's my style and my take. I do all my facelifts under local anesthesia with light sedation. This allows me to do this procedure with the patient more comfortable postoperatively, and also it allows me to position the face and not have a tube in the throat that gets in the way of me evaluating the angle. This is a dynamic process the way I do it, and I feel like I get more information and more ability to judge when I do it this way. Our patients appreciate it because they don't have to go under general anesthesia, and they also feel really good after their surgery. They don't feel like they're knocked out, but that's a separate topic. I think that as I said, when you are meeting with doctors and when you're doing research, you're going to see a lot of claims of procedures by name, like a deep plane facelift, and someone saying that their preferred method is another type of facelift. A competent and experienced cosmetic surgeon knows all those methods and has a lot of experience with all those methods. So really it's about the style and the aesthetic outcome. What is a great result for one surgeon who likes a more natural result may not be aggressive enough to someone who wants a more exaggerated result. And this is why there's a variability in the aesthetics and style of doctors. We're all individuals with our own style, and then of course you can judge that by looking at the doctor's before and after pictures and getting a sense of your rapport in conversation during consultation. So once again, to answer the question, in my practice, I feel it's very important to customize. It's very important to understand the different options. And then last, I would also mention that something that's also underappreciated is that the bone at the point where the jowl is, right in front of the jowl, is called the mandibular notch. This is an area which is indented. So when you think about it, even when you lift, if the bone is still indented, you may feel that there's a little bit of a jowl left. So to an example of how we approach this, we can approach it by putting some type of a facial implant, like a pre-jowl implant, or you can do it later after the surgery. And it's something that we do more with our patients. Is we advise them that there's the presence of this indentation. And what we do in our practice non-surgically is something called a Y-lift. And for people who are good candidates who aren't going to have facelifting surgery, the Y-lift is a great option where we use fillers such as Juvederm Ultra Plus and Juvederm Voluma to place under the muscular layer to create more continuity in the jawline. And for people who've had facelifts in the past, who have this little notch area and think they need a lift again, they really see the benefit of doing this. A procedure that takes less than 30 minutes it's not even surgery, it's actually an injection procedure, and it creates great results. So when you think about the jowl, yes, it's one term to describe the lack of continuity of a jawline, but there are at least three distinct factors. There's fat under the skin, there's fat from the buccal fat pad, and then there's the absence or resorption of bone. Remember, facial aging is a combination of volume loss from bone, muscle, and fat, as well as descent. So understanding all of that, I think, will help you really make the right decision when the time is right for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.